As medical professionals spend long hours serving COVID-19 patients, some are bound to get sick. Many such cases have occurred in Blaine County already. And to help handle a loss of personnel because of coronavirus, both Idaho and Oregon are evolving and adapting to make sure they have enough nurses to meet the need. 6 on Your Side's Natasha Williams has more on how that works and who it's affecting.
Idaho and Oregon state boards of nursing are working to make sure they have enough nurses to continue battling the COVID-19 pandemic.
As we hear the news about what possibly could happen with hospitals being overrun, healthcare workers becoming ill themselves, we know that there need to be more people there to take care of individuals who are sick.
Both boards have started new programs to allow retired nurses to come back and help fight the pandemic.
Whether that's a nurse who no longer is practicing, maybe they retired, maybe they have just let their license lapse for a few years, maybe to raise a family or any reason. We're inviting them to come back. You get a free temporary license to go to work and do this.
We have instituted 3 licensing changes to help those existing nurses who are on the front lines and also to help encourage retirees who may want to rejoin the effort.
And it's not all just about retired nurses.
We're also looking at the other end of the age spectrum kind of for students. So there are a lot of students around the state that are in, excellent nursing schools. We have excellent nursing schools in Idaho.
The Idaho board is waiving fees on their apprenticeship program for nursing students. The board is also allowing graduates of nursing programs extended licenses while they wait to take their national nursing test called the NCLEX.
Some of these students, especially in the apprenticeship program, they must get so many hours of clinicals. And right now it's really tough to do that. So we are actually allowing schools to count 1 hour worked for 1 hour of clinical that's expected. So that's also helping them.
They're also allowing nursing students set to graduate this spring to help fight the pandemic with some restrictions.
So we're saying if you were scheduled to graduate this spring, then we are going to issue a free temporary license for you to go to work. Now that license has restrictions, so you must have extra supervision, but there are things that you can do. You can jump in and help out.
To help meet the need in Oregon, actively licensed nurses and nursing assistants licensed in another state or U.S. jurisdiction are now able to provide care in the state under special emergency authorization.
So that will help both bolster the in-person and telehealth care to Oregonians.
Both boards say making sure the medical personnel have the skills and capability to help is a top priority.
Still maintain integrity, still maintain safety in the process to make sure that the nurses who are going to be jumping in there and helping out actually have the credentials, have the training, they are competent in what they're doing.
Natasha Williams, 6 on Your Side.
And if you'd like to learn more about these programs, we'll have a link for you on our website. Just head to 6onyourside.com and click on coronavirus.